My name is Ivory Griffin, and I'm a clinical educator. So I worked as a youth development specialist, and day-to-day activities were helping mothers, teen mothers at a youth homeless shelter, help them manage their day-to-day life, train them in life skills. So I did life skill workshops with them. If you have the right certifications and then the right mentor to help you, you could become a case manager. So I had the right mentor, the people with the right certifications to actually help me. And after I finish all my work for the day, I will always go ask case managers, do you need any help? Is there anything I can do? Sometimes they say yeah, sometimes they say no. But on the days that they do say no, I just sit in their office and look at what they do. I started learning that way. Then eventually, asking, being persistent, wanting to learn, wanting to grow into it. One of the case managers took me on and started training me in case management. When a role came open for case managers when they needed one, I applied and got it with her help. Transitioning from case management to being a clinical educator I had a bad experience at the shelter that I was working in. They hired a new manager that I was not getting along with well. So I knew that I had to eventually leave. One day I was talking to one of my friends about how I was feeling emotionally, telling her that this job is no longer a job that I'm happy to be at. It's actually more emotionally draining due to this one person. And she was like, well, I just applied for this job as a insurance, something to do with health insurance at this hospital. And maybe you should try to look into that. So she told me the hospital name, and I went on their website and seen that position was open. And then I seen the clinical educator position open. So what I did was I put an application in the same day I actually called. I introduced myself, told them I put an application in, that I'm interested in being interviewed for the position. And they explained to me that actually, they asked me, do you have these certain credentials? And I'm like, yeah, I have all of those credentials. He actually offered me an interview. I went on an interview and was hired on the spot. My advice to anyone starting their career in mental health and social work is know yourself first. Because how can you help someone or become an asset to someone or someone else's life if you barely know who you are and what direction you're going in? So pay attention to who you are, focus on who you are. Put yourself first,